Welcome to another series of biofunctional dynamic analysis. Most of the patients that try to get alignment of the teeth, they understand that necessarily tooth alignment doesn't mean health or function. Most of the cases that they tried it without the proper knowledge of function can end up with cervical compressions or kyphotic necks or compression of the vertebral spaces, what can create neuropathies. An ideal treatment in orthodontics and orthopedics try to develop the face, creating the compression of the joints and also profiles that they feel more physiologic. In this particular patient, the patient was in Invisalign treatment for a long time, and when the patient was studied for the research purpose that we're doing, we try to analyze the joint position and the cervical spine and all the relation with the craniocervical structures. In these particular cases, we can see how the neck is totally straight with a normal pattern, and we can see how the spaces in the cervical vertebrae, mostly in this area, are collapsed. The insufficient space between these vertebrae, where root nerves pass through the spaces, will create neuropathies. That mean impingement of nerves that can create pain that can refer to another parts of the body. We make different analysis in the cervical spine, and it's more important than most people think. The part of the brain is not just containing to the skull. We have an important structures that walk inside the vertebrae and create a lot of neurological information. If we see in this patient and we analyze the foramen magnum, for instance, and we try to look for the connection and the spaces all the way into the deepest part, we can see how the vertebrae are impinging the canal, what create a lot of neurological issues. It's different ways that we can make analysis, and with previous x-rays we can see the function and the dysfunction of these cervical spines. If we make an analysis that is go more deep into the cervical spaces and we go directly to the joints, we can see how the temporomandibular joints are totally collapsed. It's not a space for the disc, and it's basically a total collapse what induced the dysfunction in the patient. This patient was using retainers for a long time, and what we noticed in function is that the patient was not stable to be with the teeth together. But the occlusion was forced to be collapsed, creating a seal that forgot how important was to have freedom at the compression into the temporomandibular joints. This X-ray shows 6 different cuts of the temporomandibular joints in space, and we can measure and analyze what can be the different aspects and factors. If we can measure the space in this temporomandibular joint, we can see that we don't even have 1.2 millimeters in space, and we can see how the other joint is in the range of not even 0.71 millimeters. This can really create neurological and dysfunctional issues. Besides that, the factor that the patient has the tendency to relapse the position of the teeth. It's really important that occlusion is a systematic condition that affects the entire body. It's important to understand that the physiology of the movement requires freedom. Nothing can be contained, nothing but can be totally locked in a position. If we zoom into the joints, we can see that it's not a space and all both joints are compressed. This is the preliminary part of the study, and in the future we expect to have a reposition of the mandible to see what is going to be the treatment that needs to be done. We try to use the physiology of the muscles, the physiology of the posture, and the dynamics of movement to analyze what is the conditions that require freedom and stability. Every single vertebra in this particular patient is creating problems in different dimensions. And we're talking not just in one spatial position. We can see how it's a curvature between all the cervical spaces and how the apophysis of the vertebrae, they create an S pattern. So this is more complex than we think can be. So it's important to understand that the alignment of the teeth doesn't necessarily mean health. Doesn't necessarily means that your bite, because your teeth get together, forced by muscles, they can be forgiven in the position and compression of the temporomandibular joints. We have the technology today that we can plan the cases for the initial stages. We can see how this curvature in the sagittal plane of the cervical spine is creating problems for this patient. It's important to understand that the mandible is attached to the hyoid bone, and the hyoid bone is attached to the constrictor superior pharyngeal muscle and medial pharyngeal muscle to the vertebra cervical number 3. This compression and this relationship make that all the structures work as a unique unit. Depends on where you put the mandible, that will create an effect into the hyoid bone and the cervical spine. This will affect the swallowing patterns into the patient. Most of these patients that they have compromised the airway is because the mandible has been blocking the space and the airway canal. We need to be able to understand and transition the patients in a pattern that we can demonstrate how the patient can be analyzed and properly measured to the proper spatial relationships. We have today different software that allows that we can measure the volume of air into the patients. The areas that we measure goes for the spinal posterior nasal process to the cervical vertebra number 3. This is the area that we can relate, and we know the attachment of the muscle that we dictate how can be gonna be the airway of the patient. This particular patient chose an airway that is not that compromised because the cervical structures creating the space into the system, something need to give up. If we can see the rotation of this vertebral process, as you can see here when I move back and forth, we can see that all this anatomy of the airway is affected by the position of the vertebrae. All the vertebrae has an input into this airway. The airway is dictated by 50% cervical spine position and 50% mandibular position. Stay tuned, we're presenting a research of 30 cases that we're gonna analyze the different factors. I'm gonna be March 16 at the College of Implantology of Baja California. We're gonna have this 6th symposium, international symposium of implantology, and I'm gonna be showing for 8 hours all the principles of biofunctional dynamic occlusion. Also, you guys gonna have the opportunity to share some time and see some of my clinical experience in IDS. Stay tuned, and we're gonna have a lot of information that is gonna help us to visualize what technology can do those days and how we can benefit patients for this technology. It's a lot of new things coming. Stay tuned, and thank you for being with us. Have a great night.